auto injuries, presented by Dr. Daniel Lonquist, certified in chiropractic spinal trauma at the Back to Health Wellness Center. The mechanics is part of the physics that deals with the natural forces that act on moving or stationary objects. Biomechanics is related to those forces acting upon something that is alive, in this case, the passengers in an automobile. So who is hurt worse, an older person or a younger person involved in an auto accident? Most people get this one correct. The older person gets hurt more. The reason why is that they lack muscle strength and mass. The stronger the muscle and the more muscle mass, the less movement. Movement is what injures the body in an accident. Also, they usually have pre-existing conditions. Women usually are hurt the worst in an accident. Again, this is because most women have less muscle strength and body mass than a man. Your head will usually move faster than your neck, depending on the size of the vehicle that hits you, the type of vehicle you are in, etc. The force of an impact must go somewhere. Energy is never lost, and it gets transferred from one object to the next. If you hit a pool ball into another ball, one ball stops and the other takes off. The force and energy of an impact goes into your body like this. Numerous studies have found that in a low-impact accident, the amount of damage to your car has no relationship to the amount of injury to your body. Waist seat belts act like a hinge, forcing you to bend and be more injured. Shoulder seat belts cross one shoulder and cause the body to twist in an accident. They therefore do not reduce injuries to the neck and back. If your head is turned to the side at the time of impact, you will sustain twice as much injury, since it is not easy to bend a twisted neck forward. If the road is wet, it means you will move more. The more the occupant moves, the more injury you will get. If your foot is on the brake, the car moves forward less, so you get injured less. It is better to brace or tighten your body with a slight bend in the elbows than to remain relaxed. Headrests are not supposed to be used to rest your head. They are meant to stop movement backwards. Most headrests are set to rest on. This increases injury by acting like a ramp, which your head moves up and over. Only 20% of headrests are set properly. Several studies have been conducted to determine the extent of people's complaints regarding injury, up to 3 years after settlement. More than 51% of all people still complained of pain and suffering demonstrating that the majority of people are truly hurt in an accident. The reason people are in pain and suffer for so long after an accident is because they fail to get proper care to repair torn muscles and ligaments and to restore normal range of movement to the joints that were injured. There are two types of car designs that result in two types of collisions: elastic and plastic. A car designed for a plastic collision is designed to brake at certain points in the car, so the impact and energy are absorbed by the car and not transferred to you. A car designed for an elastic collision is designed with bumpers that spring back to protect the car, but transfer the energy of the collision to the occupants. The safest cars are designed to break apart in a controlled fashion, so the car gets damaged and not you. Side impact accidents tend to injure the spine less than a rear collision because you do not easily move to the side. Movement front and back is more damaging to the body because you move your body more. Auto accidents occur at a rate of 1.2 per second in the United States. That's more than 103,600 accidents per day. Chances are high that you will be involved in at least one accident in your lifetime, and if you live in a metropolitan area, those chances may increase in frequency and severity. In the case of Grand Junction, Colorado, where I live, the rates of auto accidents are approximately 1 in 10. So every person will get in an accident once every 10 years. The damage to your body may not show up for days, weeks, months, or years. Such symptoms as headaches from accidents may not show up for days or even weeks, while osteoarthritis may not show up for years. The force transferred to the body from an average rear-end collision in a normal mid-sized car may be as high as 5 times the force of the actual collision. In a 10-mile-an-hour accident, the transferred force may accelerate the body up to nearly 50 miles per hour. The injuries arising from auto accidents are primarily to the spine, muscles, and ligaments. Chiropractors, because they specialize in the treatment of these injuries, are best suited to document, analyze, and correct problems resulting from accidents. You might be unaware that a Doctor of Chiropractic is required to complete an education very similar to that of a medical doctor. Chiropractors are trained in pre-med, then 4 years of Chiropractic College, and are licensed in all 50 states. Like the curriculum of medical schools, a chiropractor's education is devoted to scientific subjects such as anatomy, biochemistry, microbiology, pathology, public health diagnosis, clinical disciplines, and the health sciences. In addition to the traditional chiropractic training, Dr. Lonquist at the Back to Health Wellness Center has also taken postgraduate training in spinal trauma, specifically dealing with injuries related to motor vehicle accidents. Following this training, he obtained the designation of Certified Chiropractic Spinal Trauma. Over the past 15 years, Dr. Lonquist has helped well over 1,000 people recover from auto-related injuries. A study published in the Journal of Orthopedic Medicine showed that 72% of patients with neck pain and restriction but no neurological deficits responded very well to chiropractic care. In that same study, it was found that of patients with neck pain, restricted movement, and neurologic symptoms, 94% responded positively to chiropractic treatment. Because chiropractors specialize in the structure and mechanics of the body and are familiar with working hand in hand with other professionals, they can contribute to greater settlements and greater patient satisfaction. As a gift for watching this presentation, anyone mentioning the presentation when they call to schedule an appointment will get a complimentary consultation to see if we can help you or someone you love recover from an auto accident related injury. All you have to do is call our number 970-257-9199 and mention the presentation, and we can set you up for that complimentary consultation.